Hi, I'm Pastor Fred at Startview. This is Dr. Raad. We receive a lot of questions, and we want to make sure these questions are answered. So we're going to start this 101 question and answer time with Startview. Dr. Raad, are you ready for some questions?
I am ready, and I want to thank everybody at Start Butte, all the patients that have been loyal to us. Hope we're answering most of your questions, and if there's new ones, we hope to get those answered too.
Absolutely. One of the questions that comes up, particularly when I'm involved in groups and community groups like churches, someone would come up and say, well, how do I know when I'm addicted to opioids? So how do you respond to that?
Well, I think anybody who has an addiction feels that they cannot leave home without it. They feel like their whole day is consumed with obtaining that substance. We can get into certainly the neurochemical part and the physiology of addiction, but suffice it to say that a person who is suffering from an addiction, their day is consumed with obsessed with obtaining the medication just to feel normal. And a lot of that could begin as something simple as being accidentally placed on an opiate or use recreationally. Either way, the end point is their lives are consumed, unmanageable with these drugs.
Okay. One of the things I hear often too, is addiction really a disease?
Well, the AMA certainly says it's a disease, and to be a disease, there's got to be certain signs and symptoms. And if you look at what addiction has done, it's truly what we call a brain disease.
Okay.
It's a disease that certainly can affect all the organs of the body, but we do know with certain scientific studies and through markers that the addicted brain does look a little different than what we expect to have a normal brain to look like. So, yes, it is a disease. It has signs and symptoms. Fortunately, today we have treatment that will include medication, but it'll also include a very intense, structured treatment of 12-step support and therapy.
Okay. Speaking of treatment, what is medically assisted treatment, Dr. Raad?
Well, over the last years, we've been able to offer patients here at Start Butte and all over the availability to use a medication called buprenorphine. And buprenorphine associated with its counterpart naloxone will give us suboxone. This medication will reduce some of the withdrawals,
Okay.
some of the physical and emotional withdrawals, but only in a medical assisted treatment and therapy can this medication work. So for all practical purposes, MAT is a attempt to look at patients, treat their addiction through medication and through structured therapy.
Okay. So if someone comes to Startview, kind of summarize what are the basic components of our treatment program, Dr. Raad?
Well, let's certainly say that we would hope to serve and treat and offer everybody a program of recovery, not just giving a medication.
Okay.
So our program is unique and a novel one using telemedicine because this monster called opioid addiction is deadly.
Yes.
It doesn't wound, it kills. And what we can offer patients via their smartphone is an opportunity to obtain treatment through pastoral care, which you offer through a 12-step support, through therapy, through videos and apps that we hope to offer you as well, along with the medication. But let's not underscore that this medication alone is not going to get someone sober. It takes both to work.
Okay.
And MAT will offer both of these programs.
All right. You mentioned medication. I hear quite frequently, in fact, 2 questions this week. How do I take my suboxone? Can you kind of alleviate or give us some insight on that?
Well, we offer suboxone either in a film or a pill form.
Okay.
And ideally, it should be taken twice a day.
All right.
It's not necessarily effective with food, but it should be spaced anywhere from 10 to 12 hours. So a patient needs to be compliant, taking it as prescribed, not misusing it, not diverting it. We hope that patients, in addition to taking it, will obtain a safe box to keep it locked up. It is a scheduled drug. It can be deadly in children, so we want to be sure that if you do have children around, be sure you're keeping it like any other medication in a locked, secure place. But in taking this medication, always ensure that it's at least 10 to 12 hours in between doses, devoid of food, it's okay, but be compliant with the medication.
So it doesn't matter whether you take it before food or after eating or what?
Not at all.
Okay. Here's a question I was asked. Does it matter whether your mouth's dry or wet when you take it?
Well, it's a good question. Certainly these medications depend on the saliva because they're asked to place it under your tongue or on your tongue and let it dissolve, only because that helps to reduce.
Here, that very often. I hear like, if you relapse from alcohol after a year or so of sobriety, you got a horrible headache or, something like that. But recently, 2017, over 2,500 deaths related to opioid addiction and other drugs in North Carolina alone. Why is it so deadly, Dr. Ray? What's going on?
Well, unfortunately, a lot of opiates off the street are laced with many other medications, i.e. fentanyl, which can be procured and actually obtained as well as manufactured in anyone's home. It's a deadly drug. It is not responsive to Narcan, which we know counteracts the effect of an opiate. But the bottom line is, if you think of that number of 2,400, you have to think up to 3 to 4 times that amount of patients that have had accidental addiction
Right.
and overdosing and were able to be revived. So the startling figure is much greater than that. But again, we said it before, this disease doesn't wound, it kills.
All right, I'm in the program. I'm on the suboxone. How long am I going to be on the suboxone? How long does this treatment program work, or how would you answer that?
Well, it's a good question. I think that what I would hope a patient's able to do, since we have no major guidelines, is we would hope that a patient will be able to live a life that's drug-free by getting employed, working the steps, getting involved with their family, becoming a productive person. If that means you're on suboxone, then over a period of time, which could be anywhere from 2 to 3 years, you would need to taper off. Now, understand, a lot of patients didn't get on this overnight. Many patients have been on these opioids for over 10 to 20 years.
Wow.
So we don't expect them to come out overnight. But again, let me assure you that life can be lived without these drugs. Let's talk about suboxone. We're not substituting, we're transitioning you to live a life that's eventually drug-free. How long it takes is an individual assessment. And we hope to individualize every patient to get them down to the least amount of medication so that they can eventually live a life that's drug-free.
Well, those are the questions we have for this week. We'll be doing this each week and look forward to your questions. And please, we really encourage you. Don't ever feel like, I just don't want to answer that question. I don't want to say anything. I feel like I'm dumb. No, the only one that's dumb is when you don't ask the question. So please do. And I'm Pastor Fred. I want to say goodbye to next week. Dr. Raad?
I want to say goodbye and thank you again, and we'll keep these podcasts going.
That works for me.
Thank you.
Have a great weekend. Bye-bye.